Good morning to all. Today I am going to discuss about anticholinesterases. So, what is anticholinesterase? So, anticholinesterases are the drugs which increases the levels of acetylcholine. Okay, and it is after it is releases from the cholinergic nerve endings by the inhibition of both acetylcholinesterases and butyrylcholinesterases. Okay, so anticholinesterase drugs are prevent the hydrolysis of acetylcholine. Why? Because so the hydrolysis of acetylcholine requires acetylcholinesterase and butyrylcholinesterase. Okay, so acetylcholinesterase and butyrylcholinesterase enzymes are required for the hydrolysis of acetylcholine. So nothing but these two enzymes are required for the inactivation of acetylcholine. Okay, so these two enzymes, these cholinesterases enzymes are inhibited by our drug. So name is our drugs category is anticholinesterases. Okay, anticholinesterases is nothing but these are the drugs. The drugs are which increase the levels of acetylcholine. Okay, at the nerve endings after releases from the cholinergic nerve endings by the inhibiting of cholinesterases enzyme. So cholinesterases enzymes are two types, that is acetylcholinesterases and butyrylcholinesterases. Cholinesterase. Okay, so simply anticholinesterase drugs are protects the acetylcholine from hydrolysis and it potentiates the effect of what cholinergic. Okay, and chemically, anticholinesterase drugs are two types, that is carbamates and phosphates. Okay, so these are the either esters of carbamic acid or derivatives of phosphoric acids. Okay, so except four drugs, that is endorphinium, tangerine, donepezil, galantamine. So these drugs are act like a what carbamates, but they are chemically non-carbamates. Okay. Next one is classification. So coming to the classification, they are divided to two categories. That is reversible anticholinesterase drugs, nothing but reversible cholinesterase inhibitors. Okay, so this reversible cholinesterase inhibitors are binds with cholinesterase enzymes. Cholinesterase enzymes are two types, acetyl and butyryl cholinesterases. Okay, the reversible inhibitors are binds with cholinesterase enzyme. Okay, so for the period of minutes to hours. So after that, it can be releases from that particular site. Okay, next irreversible cholinesterase inhibitors are also binds with cholinesterase enzymes. Both are binds with cholinesterase enzymes. Okay, but reversible inhibitors are and the binding time is only for period of what minutes to hours. Okay, but irreversible cholinesterase inhibitors are binds with cholinesterase enzyme and it forms a permanent covalent bond. Okay, and these irreversible inhibitors, the irreversible cholinesterase inhibitors are inhibit the uh, inhibit the inactivation of acetylcholine. Okay, and coming to the examples, irreversible inhibitors are two types, carbamates and non-carbamates. So carbamates examples is physostigmine, neostigmine, pyridostigmine, rivastigmine. And non-carbamates examples is endorphinium, tangerine, donepezil, and galantamine. And irreversible inhibitors also two types, that is carbamates and organophosphates. So carbamates examples carbaryl and propoxyl. And organophosphates examples is diflox, icothiopate, and halathon and diazinon. Okay, so these are the irreversible inhibitors examples. Next, coming to the mechanism of action of anticholinesterases. Okay, so see this first figure. Actually, this cholinesterase, okay, cholinesterase consists of two types, acetyl and butyryl. Okay, so here this acetylcholinesterase enzyme consists of two sites, that is esteratic site and anionic site. Okay, so anionic site consists of the negative charges present. Okay, so this was the normal metabolism of acetylcholine. Okay, acetylcholine after binds with acetylcholinesterase enzyme. Okay, then what will happen? This acetylcholinesterase enzyme is required for the inactivation of what? Acetylcholine. Okay, so that acetylcholine, the breakdown products is the breakdown of acetylcholine requires acetylcholinesterase. Okay, so the breakdown product is choline and acetate. Okay, so our drugs is anticholinesterase drugs are what inhibit the acetylcholinesterase enzyme. Okay, so by the inhibition of acetylcholinesterase enzyme, there is no breakdown of what? Acetylcholine. So nothing but our anticholinesterase drugs are potentiates the actions of what? Acetylcholine. Okay, so here coming to the exact mechanism of action of anticholinesterase drugs. So here anticholinesterase drugs categories is two types, that is carbamates and phosphates, right? And carbamates are binds with esteratic site. Okay, and it carbamylate the esteric site of acetylcholinesterase enzyme. Okay, and phosphates also binds with esteratic site. Okay, and phosphorylate the esteratic site of what? Acetylcholinesterase enzyme. So after carbamylation and after phosphorylation of this acetylcholinesterases, so here for example carbamylated enzyme. Okay, so the carbamylated enzyme is somewhat it will react slowly, but it somewhat inactivate the what? Acetylcholine. But phosphorylated state of anticholinesterase enzyme is unable to inactivate the acetylcholine. Okay, because of this these phosphates are irreversible inhibitors. Okay, so because, and one more reason is these phosphates are covalently binds with what? Esteratic site. See this, the completely the esteratic site is completely blocked by phosphates. Okay, so the phosphorylated state of acetylcholinesterase enzyme is completely inactivates the it does not it is unable to, sorry, it is unable to inactivate the acetylcholine. But carbamylated state of acetylcholinesterase is somewhat, okay, somewhat inactivate the acetylcholine. It acts slowly, but phosphorylated enzyme is it reacts very slowly. Okay, and except for drugs that is what endorphinium, tacarine, donepezil, galantamine, these are act like carbamates, right? But they are non-carbamates. Okay, these four kind of drugs are binds with anionic site. The remaining all anticholinesterase drugs are binds with esteratic site. Okay, so after these four drugs are binds with what? Anionic site, and it is partially inactivate the acetylcholinesterase enzyme. Okay, donepezil, galantamine, tacarine, and what? Endorphinium. Okay, it is partially inactivate the acetylcholinesterase enzyme, but remaining all categories of anticholinesterase drugs are binds with esteratic site. In these two categories is there carbamates and phosphates, but phosphates are irreversible inhibitors because of phosphates are covalently binds with esteratic site, right? But uh, carbamylated enzyme is it reacts somewhat slowly. It is inactivate the it is slowly inactivate the acetylcholine, but phosphorylated enzyme is unable to inactivate the acetylcholine. That is a major differences between carbamylated enzyme and phosphorylated enzyme. Phosphorylated enzyme is unable to inactivate the acetylcholine, but carbamylated enzyme is somewhat inactivate the acetylcholine. Okay, and this one is mechanism of action of what? Anticholinesterases. Okay, so anticholinesterase are two types, carbamates, phosphate. Okay, they are carbamylated and phosphorylated the enzyme. What site of enzyme? Esteric or esteratic site of enzyme. Okay, so phosphorylated enzyme is phosphorylated enzyme is nothing but they are irreversible inhibitors, but carbamylated enzyme is reversible inhibitors because of it is acts slowly, but phosphorylated enzyme is it reacts very slowly, and phosphorylated enzyme is unable to inactivate the acetylcholine. So that's why it is potentiates the more potentiates the actions of acetylcholine. Okay. Next, coming to the pharmacological actions of what? Anticholinesterase drugs. Okay, so anticholinesterase drugs are here two types. Okay, lipid soluble drugs is there, lipid insoluble drugs is there. So lipid soluble drugs examples is physostigmine and organophosphates, and lipid insoluble drugs examples is neostigmine and other quaternary ammonium compounds. Okay, so lipid soluble drugs are, they are very soluble in lipids, right? So soluble in fats, and lipid soluble drugs are easily crosses the blood brain barrier. Okay, and that's why it can show the CNS action. Okay, and it stimulates the ganglion. Okay, it is more activated muscarinic receptors, so that's why lipid soluble drugs are shows the more marked muscarinic actions. Okay, and lipid soluble actions on skeletal muscle is somewhat less prominent, and lipid insoluble drugs effect on muscarinic actions is less prominent. It is less likely inactivate the muscarinic receptor. There is no central actions because of lipid insoluble drugs are, does not crosses the what blood brain barrier, so that's why there is no central actions. Okay, and muscarinic actions also less prominent, and it is a more marked effect on skeletal muscles. Okay, so lipid insoluble drugs are very effectively act on skeleton muscles. Okay, so this is a major differences in lipid and lipid insoluble drugs. Okay, so next, individually, these anticholinesterase drugs act on a ganglion. Okay, so anticholinesterase drugs stimulate the ganglion. Okay, so but higher doses of this anticholinesterase drugs are causes the what persistent depolarization of ganglionic nicotinic receptors. Okay, in a normal doses it stimulates the ganglion. Okay, but in higher doses of anticholinesterase drugs are causes the persistent depolarization of what ganglionic nicotinic receptors. So as a result of this kind of depolarization, then what will happen, there is a blockade of so what will happen exactly in that particular nicotinic receptor, there is a resistance, it will be developed at the receptors. Okay, so that's why there is a blockade of transmissions from ganglia to postsynaptic neuron, from postsynaptic neuron to muscles also. So it may lead to, finally it may lead to blockade of neuromuscular transmission via an muscarinic type of nicotinic receptors. Okay, so in normal doses it stimulates the ganglia, but at higher doses it blockade of neuromuscular tension. Sorry, neuromuscular transmission, blockade of neuromuscular transmission. Next, anticholinesterase drugs act on CVS. Okay, so anticholinesterase drugs on CVS is very complex because it is act by two ways. Okay, it is directly act on cardiac muscle, and it is act via ganglia also. Okay, why? Because of one thing, anticholinesterase drugs are prevents the hydrolysis of acetylcholine. So nothing but anticholinesterase drugs are potentiates the actions of acetylcholine. So somewhat anticholinesterase pharmacological actions are somewhat similar to acetylcholine, but anticholinesterase drugs, it potentiates the effects of acetylcholine. Okay, so anticholinesterase drugs act on what muscarinic receptors. Okay, so m2 receptors is present on cardiac muscles, right? So what is the acetylcholine action on m2 receptor? That is bradycardia and hypotension. Okay, because of m2 receptors is present on cardiac muscles, right? So then what will happen? If it is directly act on cardiac muscles, means it can show the bradycardia and hypotension, right? Then what anticholinesterase drugs, it will also affect on cardiovascular system. Okay, what is the action of anticholinesterase drugs on CVS? If it is act via ganglia. Okay, so but in higher doses of these anticholinesterase drugs, then what will happen? There is a activation of what? Ganglia. Okay, so as a result of this activation, then it is activate the postsynaptic neuron. Okay, so this postsynaptic or postganglionic neuron is stimulate the release of other neurotransmitter like noradrenaline. Okay, so noradrenaline and adrenaline, these are the sympathetic neurotransmitters, right? So this noradrenaline effect on heart is what? Tachycardia and hypertension. Okay, acetylcholine action on heart is bradycardia and hypotension. But adrenaline action on heart is what? Tachycardia and hypertension. Okay, so that's why the anticholinesterase actions on cardiovascular system is very complex. Due to this act through two ways. That's why. And overall effect is unpredictable. Okay, is depending upon the agent and depending upon its dosage also. Okay, and next actions on central nervous system. Okay, so only lipid soluble drugs act on CNS. Why? Because only lipid soluble drugs can cross the what blood brain barrier. Okay, and it is improves the cognitive functions. Okay, our anticholinesterase drugs are improves the cognitive functions. By in which situation it improves the cognitive functions, in which kind of situations, that is Alzheimer's disease. Okay, so what is Alzheimer's disease? Alzheimer's disease is nothing but is a neurodegenerative disease. Okay, it is a neurodegenerative disorder. Because of in Alzheimer's disease there is a lack of what cholinergic neurons. Okay, there is a degeneration of what kind of neurons? Cholinergic neurons. It is occurs due to degeneration of cholinergic neurons. Okay, so actually cholinergic neuron function is it is a improve the cognitive functions. It is involved in it is control the memory, it control the some what mental functions. Okay, here our lipid soluble drugs mainly it is used for the treatment of Alzheimer's disease. Why? Because in Alzheimer's disease there is a lack of cholinergic neurons. Okay, there is a lack of activity of cholinergic. Okay, the cholinergic activities decreases in Alzheimer's disease. Okay, so our anticholinesterase drugs are potentiates the actions of that cholinergic activity. Okay, so that's why that lipid soluble drugs are improve the cognitive functions in Alzheimer's disease. And high doses of these lipid soluble drugs, it causes the what? Excitement, confusion, and tremors and convulsions. Tremors is nothing but involuntary shaking movements. Okay, convulsions is nothing but it is a sudden and violent sudden jerking movements. Okay, sudden jerking movements, involuntary body movements, it occurs, followed by coma. Okay, high doses of this drugs also causes the coma. First, what will happen? Excitement, confusion, tremors, and convulsions, and followed by coma. And next, actions on skeletal muscles. Okay, so normally acetylcholine action skeletal muscle what? Contraction effect. But our anticholinesterase drugs are potentiates the actions of what? Acetylcholine. So that's why it is anticholinesterase drugs and skeletal muscle is sustained contraction, and it produces the twitchings and fasciculation. Fasciculation is nothing but involuntary muscle contraction, and twitchings is nothing but what? Sudden jerking movements. Okay, and involuntary jerking movements. Okay, and next one is these anticholinesterase drugs are increases the muscle strength in myasthenia gravis condition. So what is myasthenia gravis? Myasthenia gravis is a one kind of autoimmune disorder, right? Autoimmune disorder. Okay, so in this it is occurs mainly due to there is a lack of communication between what? Muscle cells and neuron. So it is occurs due to blockade of which kind of transmission? That is neuromuscular transmission. Okay, so myasthenia gravis is mainly occurs due to blockade of neuromuscular transmission. So finally, what will happen? There is a lack of what? Nerve impulses propagation from the neuron to muscles means what will happen? There is a muscle, it will becomes to very weak. Okay, paralysis is also happens. Okay, so here our anticholinesterase drugs are increases the muscle strength in myasthenia gravis. Myasthenia gravis is nothing but the main symptom of myasthenia gravis is weakness, muscle weakness. So that weakness will be restored by our anticholinesterase drugs. Okay, and high doses of this anticholinesterase drugs are causes the persistent depolarization. Okay, so as a result of persistent depolarization, there is a resistance inevitably increases. Okay, the resistance is increases at the receptor region. Okay, so that's why there is a blockade of transmission. Okay, from neuron to muscle. Okay, nothing but there is a blockade of neuromuscular transmission. So then what will happen? The muscle is unable to receive the signals from the postsynaptic neuron. Okay, so the muscle is unable to contract due to lack of receiving capacity of that nerve impulses. Okay, so that muscle, that's why the muscle becomes to very weak, and muscle also become paralysis is also happens, muscle weakness and paralysis. And other actions. Okay, so overall our what anticholinesterase drugs are potentiates the effects of CNS, sorry, potentiates the effects of acetylcholine. So what is the action? So acetylcholine, other actions, that is normally acetylcholine action on GITs increases the peristalsis movement, increases the gland secretion and smooth muscle contractions and meiosis also. So all these acetylcholine actions are potentiated by our anticholinesterase drugs. Okay, anticholinesterase drugs are enhance the GI motility and increases the glandular secretion, and it causes the bronchoconstriction and voiding of bladder due to contraction of the detrus muscle and relaxation of urethral sphincters and meiosis and nothing but constriction of the pupil. Okay, the size of the pupil is decreases. So there is a intraocular tension is also decreases, in particularly in glaucoma patients. So that's why anticholinesterase drugs, especially physostigmine, is used for the treatment of glaucoma. Okay, so these are the other effects. Next one is pharmacokinetics. So pharmacokinetics of anticholinesterase drugs. So what is pharmacokinetics? Means the study of ADME, absorption, distribution, metabolism, excretion. Nothing but what body does to the drug. Okay, so here I will differentiate about two kinds of drugs, that is lipid soluble and lipid insoluble drug, that is physostigmine and neostigmine. These are the main two drugs. And physostigmine is it is obtained from Physostigma venenosum. Okay, it is a natural alkaloid. Okay, it is obtained from one kind of seed, that is calabar bean. Okay, and neostigmine is a synthetic drug. Okay, and physostigmine, it is a tertiary amine derivative, and neostigmine is quaternary ammonium compound. Okay, and the oral absorption of physostigmine is very good. Okay, but oral absorption of neostigmine is very poor. Okay, and physostigmine it crosses the blood-brain barrier. That's why CNS actions are present. And neostigmine does not crosses the blood-brain barrier. Okay, that's why CNS actions are absent. Okay, and physostigmine action on what cholinergic receptors is absent, and neostigmine action on cholinergic receptor is present. Okay, and what is the main use of physostigmine is mitotic means what? It is a substance. Okay, that substance is used to construction of the pupil. Okay, it reduces the size of pupil and it reduces the intraocular tension. Okay, mitotics. So it is used as a mitotic in glaucoma. Okay, that's nothing but it is used for the treatment of glaucoma, and it is used for the treatment of atropine poisoning. Atropine is obtained from the natural source, that is Atropica belladonna. Okay, and neostigmine. Neostigmine, it is used for the treatment of myasthenia gravis. Okay, myasthenia gravis is nothing but muscle weakness, and it is used for the treatment of what? Post-operative paralytic ileus. So what is paralytic ileus? Okay, so this paralytic ileus is very common after the surgery. So nothing but there is a mechanical force which is present in the intestinal region is decreases. So that's why there is a decrease in the passage of food contents in the intestinal regions. So that's why there is a what there is no food passage in the intestinal region, means the food is, it may accumulate in the intestinal region. Okay, so that kind of situation is treated by our drug, that is neostigmine. Okay, so that kind of paralytic ileus is very common after the surgeries. Okay. And what is the duration of action? Physostigmine systemic systemic is nothing but physostigmine. It is given through IV route, means it is directly enter into the systemic circulation. And the duration of action, if it is given to IV route, means the duration of action of physostigmine is 4 to 6 hours. Okay, and if it is given as eye drops, okay, so the duration of action is 6 to 24 hours, and the neostigmine duration of action is 3 to 4 hours. Okay, and this one is the major differences between physostigmine and neostigmine. Okay, so in next class I will discuss about uses of what anticholinesterase drugs uses, and what is the anticholinesterase drugs poisoning also. Okay, and the treatment of anticholinesterase poisoning also. Okay, and so this one is information about anticholinesterase definition, and what is the chemistry, and what is the classification, and their examples, and mechanism of action, and pharmacological actions. Okay. So in next class, I will discuss about uses of anticholinesterase drugs. Thank you.